Might as well begin, I think.
Okay.
Hello. I know we've got at least one person online watching at the moment. If you want to say hello, feel free to do that in the comments box, which will pop up on our right-hand side, so we'll know who's here. And if you've got any questions as well, feel free to add a question. This is the first time we've done this, so hopefully it'll be a good experience, and a few more people have joined us. The reason, well, first of all, we'll introduce ourselves actually. So my name is Paul Pilkington. I'm a senior lecturer in public health here at the University of West of England, part of the public health team. And this is...
Hi, I'm Emma Bird. I'm a senior lecturer in public health as well, and I lead one of the modules as part of the programme.
And we're both admissions tutors, so you might recognise our names if you've already applied for the course. And yeah, this was sort of our idea really to do this. We've got nobody else to blame but ourselves that we're having to do it on a Friday at 4 o'clock, our first time really doing Facebook Live. So we've not had any questions sent in beforehand. So what we're going to do is talk a little bit about the university and then talk about the MSc itself. And you may have some questions as we go through, and then we'll carry on as long as we need to. But feel free to say hello, so we actually know that this thing's working for a start. So if you can hear us, you could let us know. You could just let us know that you can actually hear us talking. Hopefully you can. It's slightly unnerving actually not knowing whether actually you can hear us. Can someone just test it out actually? Someone who's watching at the moment just test it out. Hello, Nazrul.
Oh, hi,
so
Nazrul.
Can you hear us? And John, hello. Can you actually hear us okay? Just say yes or no. Actually, if you can't hear us, then you won't be able to answer, can you? Yes, brilliant,
great.
fantastic. Okay, right. So I'll start. So we thought it might be quite useful for people who are from other countries to just hear a little bit about where the university is in relation to the UK. So it's just based on the outskirts of the city of Bristol, just a couple of miles really from the centre of Bristol, which is in the southwest of England, about an hour and a half train ride away from London, and also good connections to other parts of the country as well, including the northwest of England, which is where I'm from originally. Give that a plug, Liverpool, Manchester. So a really good place to be. Hello, Atta and Ria. And a really good place to be in terms of location. And Bristol is a great city, which Emma will attest to because she actually lives in Bristol,
Yes,
like me.
Very proud Bristolian. So yes, it's a lovely place to live. Yeah,
so very good social scene, as I've heard.
Mm-hmm.
And just a nice little city really. So it's a nice size. And the students tend to really enjoy being in the city. As I said, the university, well, our part of the university, which is the Frenchay campus, which is the biggest campus, is based on the outskirts. And there's a few other campuses in and around the city. One campus is based in the city centre in different buildings. And then there's a couple of other campuses, including a campus just across about a mile away, which is in a nice rural part of the city, which trains nurses mostly, and we used to be based there, but now we're based on the main campus. So maybe just talk a bit about the university itself. It's quite a big university in terms of the number of students and then the number of staff as well. There's about 30,000 students, undergraduates and postgraduates across the different campuses, and thousands of staff. I don't know quite how many. I think it's about 4,000 staff.
I think that's about right. Yeah.
Yeah, and we're two of them. It's as you can imagine, it provides lots of different courses. Pretty much anything you can think of, really. Apart from kind of the medical, we don't have a medical school, but we do train a lot of health professionals, nurses, midwives, health visitors, paramedics, and of course public health as well. And one of the good things about UWE is that we have quite a lot of cross-faculty working in terms of the research that we do, and also teaching as well. So we work quite closely with colleagues in the Faculty of Environment and Technology. So that includes architects and planners and people in geography. And we also work with people in the business school sometimes as well. And we're actually in the business school building at the moment, and we might sort of point the camera around in a minute to actually show you where we are, to give you a sense of this new building that we're in. But in terms of our team, we're quite a big team, aren't we?
Yep, we've got around 14 or 15 of us who sort of form the main core public health team. So we've got a number of professors who have research interests in loads of different areas, so around school-based health, physical activity, older people, public health sort of history, which our professor David Evans is starting to do a lot of work into. Then we've got a number of senior lecturers, so there's the two of us, and we've got about 5 others as part of the team. All of us are very research active. We really like the kind of mix of doing our teaching and then having our research as well. And again, we've got a really broad range of interests within the team. My personal interest is mainly around sort of the built environment and health. Also do a bit of research around physical activity, health education in schools. So those are my sort of key areas. And then Paul, I don't know if you want to say a bit about your area.
Yeah, quite similar to Emma's. We've done quite a few projects together,
yeah.
Coincidentally, and so we've done some work looking at the links between health and the environment, like most notably the built environment, and work on road safety as well. One of the things that we do at UWE is to try and bring our research into teaching. So the modules that we teach, we do bring in examples of work that we've been doing, and other colleagues as well, to try and make things as real as possible for people. And students can also get engaged with our research as well. So sometimes that's through picking research dissertation projects which are aligned with the work that we're doing. But also there's opportunities for students to actually stay at UWE, sometimes to get involved in research projects. And we've had a few examples of that over the last few years, where students have done the MSc, have actually then applied for a position in a project, a research project, and then they're still here now. We haven't managed to get rid of them. Joking, but so we've got really good students who we have, and Janet is one example. I don't think she's on at the moment watching, but I think she's in this building actually, working really hard. And she's going to be doing one of these sessions in a few weeks. She's agreed to do that. And we've got a few good examples of former students who are doing really well now, working in the team. Others who are doing PhDs as well. So should we talk a bit about the MSc? We've not got any questions at the moment, but maybe that's a good thing. Maybe that says we're answering questions as we go. But maybe talk a bit about the actual programme itself. It's been running for at least 15 years, and it's evolved over time, as you might imagine. One of the things that we do pride ourselves on is the multidisciplinary nature of the masters. So some masters in public health you can do, and they're actually quite medical, and often they're based in medical schools as well. And that isn't necessarily a bad thing, but sometimes it can be kind of overly medical in the approach that they take. And what we make sure we do is to include lots of different perspectives on public health from different disciplinary areas. And we're all from different backgrounds ourselves. I did geography at university, and so did Nick, who's on the team. Emma's a psychologist, and then we've got people from like history backgrounds, mathematics. Izzy, who does the statistics. Stuart's from sociology, isn't he?
Sociology, anthropology, economics.
Yeah, and it's also reflected in the students as well, like the backgrounds of the students who come on the course. So we have people from lots of different backgrounds, both students from the UK and also all across the world. And the mix of backgrounds is just really great for the students because they can hear about experiences from those different backgrounds. but together learn about public health as well, and how different backgrounds can work together to improve health. And similarly, the geographical diversity of the students really works really well, and there's a really good mix in between students from all different countries. So we're quite proud of the fact that we've got a really great mix of students and also staff from different backgrounds. I suppose we could, most of you, if you have already applied, you may well have been sent this, which looks better in colour, but we do tend to email it to people now when we've accepted offers, although it was only developed in the past few months. So if you applied a long time ago, you might not have received this. We've got a question actually from Maria, so we'll answer that in a second. If you do want a copy of this and you haven't got it, the best thing to do is to email one of us too. So it's either emma.bird@uwe.ac.uk or paul.pilkington@uwe.ac.uk. So if you email one of us too, we can email that to you. But basically, it just gives a breakdown of the kind of experiences of students who've been on the course. It tells you all about the modules that are on there, and things like the library facilities and things like that. The modules are pretty wide ranging, aren't they? Cover probably the things you might expect to cover. In terms of how many people are going to do the MSc, usually we've got between like 35 and 40 to 50 even people doing it. It varies year on year, but it never goes below like the high 30s. And some of the modules on the course are actually shared with an MSc Environmental Health programme. So some of the students will join together in those modules. So some of the modules you get slightly more students in than others. But we find that number works well.
And we also find the mixture of the students as well, having the environmental health students in with the public health students tends to work really well because, again, like Paul was saying, with the different backgrounds that people have, having that kind of environmental health perspective brings something new to the group and sort of leads to really good ideas and discussion within the sessions that we have.
Yeah, so as I say, if you have a look at that, you can kind of find out exactly the details of the modules, and of course there is information on the UWE website as well. At the moment, the course is there are no optional modules on the course. So when we thought carefully about what people needed to do in terms of maximising the kind of the value of the MSc, and we decided on a number of modules, and that these were all quite core modules, and that people should do these modules. We do always consider whether we want to introduce any more optional modules, and there are opportunities to get to do other things while you're doing the MSc. But in general, the focus is on these kind of core aspects of public health. So things like epidemiology, quantitative research, qualitative research, health promotion, which Emma leads. I lead 2 modules, one on health protection, which is about looking at outbreaks of disease and things like that, and also non-communicable diseases, which is a module which looks across all different diseases and the risk factors associated with them, the epidemiology of it. And then we've got a module on public health economics, leadership for public health, public policy, and anyone I'm missing? Dissertation.
Introduction to Public Health. It's
That's
a pretty
right.
important one.
Introduction to Public Health. So Nick runs that. So that's the first module that people do, and it's basically designed to give people this first experience of all these different areas of public health. And we have all of the team tend to contribute to that, so you get to actually meet all the team during that module, and it can also give you ideas for things that you might want to do in your dissertation, or other assessments where you can have an element of choice in what you do. So, for example, Emma's module, health promotion module, the assessment is to design a website isn't it?
So with our assessments, we try to really mix them up. So it's not like you're doing essays or exams for everything. So for the health promotion assessment, we do the development of a website where you are trained in how to use some website development software, and then you link that to health promotion theory and practice. And the reason that we have that type of assessment is to really give you something that can be practical in the real world. And I'd say that's something that we all try to think about in all our modules. It's not necessarily just kind of the theoretical background to a number of different concepts related to public health, but also to think, well, how does this apply in practice, and what can we actually do out there in the real world to make a change for the better?
Yeah, and we've got really good links with the public health community, especially in the southwest. So public health is primarily based in local authorities, so councils, local government, and there's usually a director of public health who leads the public health team there, and then obviously their team. And we've got really good links with the directors of public health. We also have good links with people in other organisations like Public Health England and Health Education England, NHS England, and often they will come in and do some teaching sessions, especially on the leadership module. And so they'll look, you can gain from their experiences around leadership. But then there's also opportunities for doing placements as well. So there are a few slots available for people to do 5-day placements where they can actually go into an organisation like a local authority, so like Bristol City Council, for example, and do maybe a small piece of work and shadow somebody in the team and kind of get some experience of what it's like to work in public health in the UK. So we really try and give people kind of an experience of what it's like to work outside, rather than just theoretical knowledge and skills, which is obviously something we do as well.
Yeah, and it's all about trying to think about as well what you might want to do afterwards. So I know a number of students who've been through the placement process who've actually been successful in doing one of those. It's really helped them to think, well, actually, I would like to work in that area of practice. It's really given me the opportunity to learn what it's actually like working in for that organisation and the type of work they do. So it can be really good for helping you to think about that. Because, well, depending on your sort of current knowledge of public health, you could almost be doing anything and it would relate to public health. So that can be really helpful if you decide that you might want to go for one of the placement opportunities that we have.
Yeah, we're always kind of looking at what people like get out of the course, and to make sure that we're kind of providing things which are useful for people. And we've recently. The team have done a review looking at those who've come from outside the UK and what their experiences have been of the Masters and how they think that it's helped them and what they think that we could do differently maybe to improve things. And so that's been done through 2 former students who did an internship. So yeah, we are continually thinking about how to make it as appropriate as possible for people. Okay, so Yasmin, hello Yasmin.
Hi Yasmin.
No, we've not really answered this question. So, how have your most recent cohorts done with gaining posts in public health or related areas? Some of that I think has been addressed in that report that was done in terms of international students, hasn't it? And we know sort of more anecdotally, locally, that we've had some really great sort of results with students who've come onto the course and either gone on to get a post in public health or been promoted within their organisation that they're already in, because we've got quite a lot of people who do it part-time and are already working in public health. The university itself, they do some monitoring of like graduate destinations, but it doesn't really give details about exactly where they're going. But we have got a lot of anecdotal evidence about how it improves people's job prospects.
Yeah, absolutely. I think particularly in terms of local authority working, a lot of our students sort of can come through that route. And like Paul was saying, gain promotion through simply having their master's qualification. And then we've also got, in terms of some of our students that have stayed on with us, that we mentioned earlier, so they finished their masters and then stayed on as researchers, and have had that opportunity to work with us on some of the different projects we're working on. And particularly thinking back to that example of Janet, who stayed on with us, she is now a researcher and is working towards a PhD. So we do have those opportunities available, and it's something we really do encourage if that happens to be your particular area of interest.
Yeah, Michelle, Sander, there's lots of people, isn't there?
Yeah.
Nazrul actually is just
Yes.
yeah, so, and there's loads actually, isn't it? It's Sada.
Sadia, yeah.
Yeah, it's Sadia, loads of people. Okay, so when will the placements take place, Iria? And did you say they're all limited spaces? There are quite at the moment they're limited, the spaces. It's limited because it requires the organisation that the student goes to have somebody there to be able to look after them while they're there. So it depends each year how many of these organisations there are that are willing to do that. And at the moment, there's a lot of pressure on workplaces because there's a lot of cuts to funding from the government. So there is some more pressure, but we have still got workplaces who are very keen to do it and are able to do it. So it just depends each year. But it's an open process in terms of if people are interested in doing it, then they will submit submit an application almost, won't they?
Yeah, it's like a short application, and our colleague Izzy, who manages that at the moment, she sort of allocates people depending on where they're living and how well they'll actually be able to access that particular placement. And I know from her feedback at our recent away day for the course, is that although we do have a limited number of placements, actually it's normally around about the number that apply that end up getting those places. So not everybody is actually interested in doing a placement. So it's not something that we have that's compulsory. It's very much up to you. So it's not a situation where we tend to have sort of 20 people applying for 10 places or anything like that. It tends to be that the people that apply do often to go on to get those places.
Yeah. Yeah, we would like to expand it, wouldn't we? And we are talking about potential ways of expanding that kind of thing, but it's not been confirmed yet. When will students know their admission status? That's one question that we're in terms of admission status. I assume. Do you mean whether you got a conditional or an unconditional offer? I'm not quite sure, because when people apply. We'll obviously assess the application. If there's some information that's outstanding that we need to look at, then we might then give that as a conditional offer, which then the admissions office at the university would then communicate to you. So they might say that you need your IELTS score to show that you've got the required level of English language skill, or it might be that we're looking. There's a couple of references missing from your application, and it just means you're getting the references up on the system. So in general, if we think academically and that you're accepted for the course, then that should be quite quick in terms of an unconditional offer. And as soon as we get the information from the conditional ones, with them that will be unconditional then automatically. So if you are waiting around and you feel that you're sort of not hearing from the university, what we would suggest is that you email the admissions team at the university, and Emma has very kindly done a pre-prepared post-it note.
Oh yes.
High tech. Let's see.
I'm not sure it'll work. Oh yes.
So if you want to write that down, you might have that anyway. The international office is more for just queries around international students.
Yeah, so the first one there, the admissions at uwe.ac.uk, is for any prospective student who's got any sort of query about their application. So if you're kind of still waiting to hear what any outcome decisions regarding your application, then contact admissions@ue.ac.uk. And if you are an international student, or hoping to be an international student here, then if you've got any queries about things like accommodation or different fees, any sort of questions like that, then we'd recommend that you contact the international email address, which is international@uwe.ac.uk.
Great, and we've got some more questions. Mohammed, yes, I think as soon as you get your IELTS confirmation certificate, just submit that as soon as you can, and then your offer then should automatically be made unconditional. So that should be straightforward. But again, if you get any problems, then contact those email addresses, or if you're really stuck, you can always email one of us too. And then we'll liaise with them on your behalf. Yasmin, if we are working alongside studying, will there be placements that could accommodate part-time hours?
So I think in the past we have had different types of placement opportunities. So there are some that have been sort of 5 days in a week, but I know that there have been some as well that have been 1 day a week for sort of 5-6 weeks. So obviously we can't promise anything at this stage because it will kind of depend on what gets set up in time for September. But we would like to think that there will be some different options to look at, and that's something that we can take back to Izzy, who organises the placements. We can actually ask her, is that something that we can look into, trying to make sure we've got those different options available to people.
Yeah. The IELTS score less than 6.5. That's probably something to ask admissions about, isn't it, really?
Yeah, it's kind of a university level criteria, so it's not something that we really have any control over. So while we do get to see all the applications from a big range of applicants, it tends to be that decision around the IELTS is a university level decision. So it's something that the admissions office will have more of a handle on, so it might be best to contact them just to check about that.
Yeah, occasionally the admissions will send through an application. They'll query it and ask us our opinion over something where there might be a bit of discretion over it. But as Emma said, it tends to be for things like IELTS. It's not discretionary. It's kind of a university rule, and then we sort of have to follow that. So.
Yeah, there is sometimes one option as well, as if you do have a slightly lower IELTS, is I know that sometimes we receive information from the admissions office where they'll kind of suggest that the prospective student completes a pre-course assessment. So some of you might have done that already. We've sent out a few this year, and it's really just a few questions based on an extract relating to a public health issue, and we ask the person to kind of try to answer some of those questions, and it's a really helpful way actually of trying to see that there might be some things on their CV that maybe might not meet the criteria for the university, but actually if they can prove in that statement that they make in relation to the public health issue that we ask about, then we can have some discussion around whether people might get a place.
Yeah. So, Rhea, will all the lectures be on the French campus?
Good question.
Yes, they will. They will. So, which is really good for us as well. We used to be across different sites, but no, all of the lectures are here, and we've got really good lecture theatres, lecture rooms on French. It might be a good chance just to move the camera around. I'll be brave and pick up my laptop and hope I don't drop it. So we'll just try and show you. Oh yes, there's with the famous Janet who we've been talking about. She's actually walking she's walking past. So we might be able to actually show you, Janet. The door's been locked here, so I can't actually go out and see her. But you might be able to see her walking there. So that's the famous Janet. So it's a bit of the campus here. You might be able to see if I was to wander down. This is the business school, so this isn't the public health bit, but this is a brand new building which has only opened at Easter. But you can use the facilities as students. And there's a student union which has got the bar and places to eat. There's a new hall of residence over there, and there's a building over there where you can see it's kind of grey with like red windows. That's the library, and it's a really big library actually. So it's a really great resource, and we've got lots of resources as well which are online as well, so you can get online journals, full text of journal articles. But the library's got really great places to work. So just Emma's laughing here.
Oh.
So we're back.
Yeah, and just something that popped into my head when Paul was doing a nice tour. Then was relating back to that question about the lectures being at French A. Very briefly, just to tell you about the structure, we have for full-time students, you would be expected to be at the university on a Thursday and Friday for taught sessions. So it runs from 9:30 till 4:30ish, and those are 2 full days. And then also on a Wednesday we have the option for students to come in for study skills sessions, for something we call PALS, which is called peer assisted, which stands for peer assisted learning. What's the
Support.
S? Support, yes. And that's basically a system where previous students, or those who are finishing up their dissertations at the moment, they actually stay on at the university, and they run classes which run sort of alongside our modules, and it means that you've got that opportunity to go along to a much more informal class with your classmates and ex-students to actually talk about some of the issues that you might be sort of wanting to discuss in a bit more detail, and to get their insight. So it can be quite a nice opportunity really to have that space to go and discuss things with people who've had the same experience that you're going through at whatever particular stage. And if you're planning to be a part-time student, then you in the first year will come in on a Thursday all day, and then in the second year you'd be coming in on the Friday, so you have a slightly different experience, but it means that you get to meet kind of you'll be spending time with 2 different cohorts, which again has its real benefits because it means that you get to meet a really huge sort of public health community when you spend your time here.
Yeah, the other bit of support is the personal tutors.
Oh yes.
So every student's got a personal tutor who's a member of the public health team, and generally we meet with them early in the year with a group. There's about 5 or 6 students per personal tutor, and that's a person you can go to if you've got any questions during the course, either about modules or anything else to do with the programme. So that's another helpful thing. Couple of questions, easy ones. The library, I think it is 24/7, the library.
Yes. Yeah.
I've got to admit, I've never stayed overnight in the library, but
we have heard stories of students that do stay overnight.
Not necessarily recommended.
No, it's not something we necessarily say you should do that, but it is there. If you are somebody who maybe works better at night, then you are very welcome to do so.
Yep.
You can swipe in with your card, and they, not that long ago, refurbished all of the library, so it's actually looking really nice now.
Yeah, there's a lot of social spaces around, like social working spaces around the university. So this building, which is a brand new building, on each floor there's 6 floors. On each floor there's lots of little spaces like chairs and tables where people can work. And this building is open late as well. Not 24 hours, I don't think, but it's open quite late, so you can come here and work as well. And I think a lot of students from different faculties will come in to use this. Other questions? John, your admission application, I'll double check about that to see if it's on the system.
I'll make a note.
So I'll do that before we leave tonight to go home. And then, yeah, chances of PhD, there's always a possibility. It depends on what comes up, but generally every year there is some sort of opportunity that comes up. And there's different ways of doing it. If you're really interested in doing a PhD, you could always like work with or talk to the academics here and try and come up with a way of actually doing it. See if there's sources of funding. Sometimes the university will advertise PhDs across the university, and it's a matter of getting together with academics to then bid for the money from the university. And then obviously there'll sometimes be specific examples of a PhD studentship that's available. So there was one fairly recently, wasn't there, from one of the centres at UWE that Emma advertised on the Facebook group. So that's another possibility too. So it's not, there's no guarantees obviously, but if you were really keen and you're and there's a right fit for a piece of work, then there's definitely opportunities to try and maximise the chance to be able to do a PhD.
Yeah, and I think as well, as if that's something that's on your mind already, is in the first couple of weeks come and speak to us, because then at least we know that if any opportunities do arise, then we can actually get into contact with you really quickly, and you can start thinking things through from a really early stage of being over here in Bristol.
Yeah. We'll probably start to close it down in the next minute or so. If there's any other questions, do feel free to ask a quick question now. I know I won't necessarily advertise the Facebook site because you know about it, because you're on it at the moment. But we set up the Facebook site a few months ago, and there's quite a lot of people on it. It's not just people; it's people from a variety of backgrounds, isn't it? It's including those who haven't yet come to UWE, but also those who are here at the moment, those who've finished. The staff are on there as well, and other people in the region that we work with in public health. So it's designed to be a place where you can kind of have an online community to share information, and it's been working really well, so we're really happy with it. The other thing to mention is the Twitter account, which Emma manages. So I've just outed Emma as the manager of that, so she usually manages it, although some people do have the password. So I've got the password. Do you know what's the Twitter handle? Do you remember it?
Oh my goodness, this is pretty terrible.
I could find it on my phone.
Yeah, that might be best. I think it's at UWE Public Health, but yes, we better just check that, because I'm not sure which way around it is.
Yeah, let me just double check. Yeah. Or at Public Health UWE.
Oh, at Public Health UWE.
Yeah,
Got it the wrong way around.
So if you're on Twitter, there's reflecting back, isn't it? Public Health UWE, at Public Health UWE. So that's just another place that you can follow us, get information about the course. But generally we'll post a lot of the stuff on Facebook.
Yeah.
Because it's kind of the easiest place to do it. But just to say, we've got Twitter accounts as well. We may in the future have a blog, but we're not sure about that yet. We're still waiting for the university to come to us with what they say that we can use as a blog. So.
Yeah. And I think one of the final things to mention is just that we are planning to do another maybe one or two sessions like this. So we kind of slightly apologise. This is the first one we've done, so we weren't quite sure what type of things would be coming up. But we like to think that we would be able to do another couple. So if you do have any questions in the meantime that you think would be useful for yourselves and also for maybe other prospective students, please do send them to us or kind of think about them, and we'll be in touch pretty shortly with the dates of the other ones. And yeah, hopefully, I imagine we might cover some of similar stuff again, but equally we'll probably try to be more about answering questions, because this session is being recorded and will be available on the Facebook site, probably making us embarrassed for a little while. Yeah.
And Janet's appeared. So Janet, you don't know, but you did actually appear on the video. We saw you walking out of the building. But thanks Janet for coming along, and Janet will be taking part in one of the next sessions. So we'll look forward to that. Yeah. So yes. So in the meantime, if you've got any questions, do send them our way, and we can always then answer them as well as part of the next session, so everybody gets a chance to hear them. But thanks for joining us, and it's really great that you took the time to do that.
Absolutely, yeah.
And we hope to see you at UWE, and definitely, and maybe also one of the next sessions too.
Yeah.
So
great. Have a good weekend, everyone.
Okay. Take care.
Bye.
Bye.